Hi everyone. Today let us learn the first unit of adult health nursing, that is introduction. In that first part we will learn evolution and trends of medical and surgical nursing. When we go for evolution of medical surgical nursing, let us know first what happened before this early history. Before 300 BCE, that is during ancient Greece, that is 5th century, people used to believe that the disease is caused due to some supernatural causes. During this time period, there was a people that is known as hypocrites. They rejected these people's belief and they promoted the observation, diagnosis and logical reasoning for the patient's disease. And these hypocrites set an ethical standard for physicians, that is, do no harm. Like, this was the ethical standard, like, do not do any harm for the patient. Then when we go for early history, there is early history, late 19th, early 20th century, and there is a modern era, that is 21st era. When we talk about the early history, this early history was oriented during the wartime, that is during the Florence Nightingale wartime period. And during this time period, Florence Nightingale period, it was mainly focuses on the wound care, hygiene and basic patient needs. No formal education was given, only the training and the observational knowledge was given to the patient. In late 19th century or the 20th century, what happens, like late 19th century, formal training started. Like in early history, there was no formal education was given, just observational training was given. Here a little formal training was provided, and the patient started and the healthcare team members started to like observation and do the thing under the physician supervisor. And there was a person who invented the stethoscope. First, in 19th century, what happened? Stethoscope came invented, and there was an outbreak of cholera too. Like how this cholera was caused, and this person, epidemic John, he told that the cholera was transmitted by a water. However, many doctor doesn't certainly like take this. Later, the Louis Pasteur, he proved that with the help of microscope that there is some microorganism or the organism which causes the disease. And in 1880, the pastor and the co-workers started to know how to cure the chicken cholera. Then later the pastor introduced the vaccine for chicken cholera, rabies and anthrax. These are the things what happens in 19th century, how the outbreak of cholera took place, and how this Louis Pasteur invented the vaccines for this cholera and all that. Later, that robot coach came, and this robot coach, he is the father of bacteriology. And here Louis, we can also know that Louis is the father of microbiology, that is modern microbiology. Louis Pasteur, he is the father of bacteriology. Robert Koch, what he did, he isolated the germ. First, the Louis Pasteur, he introduced the vaccine for chicken pox, rabies and all that. Here Robert Koch, he identified the germ who causes the disease for anthrax, cholera and tuberculosis. In this 19th century, the surgery was greatly improved by the discovery of anesthetics, and cocaine was first used as a local anesthetics. And there was a person known as John Lister. He is also called as the father of antiseptic surgery. He discovered the antiseptic surgery, and during this time period, rubber gloves were first used during surgery. And there was a person known as this Hermann von Helmholtz. He invented the ophthalmoscope, and during this year X-ray was discovered, and the same year aspirin was also invented. These are the things like how the evolution took place, how the things invented, and how the changes took place in the evolution of medical surgical nursing. We talk about the early evolution, then we talk about the 19th century. Then when we talk about the mid 20th century, huge medicines advancement took place during this century. And during 900, this is the year, that is 1900, different blood types were invented. Like blood types were identified, like O, A, B, all these different types of blood groups were identified, and first successful blood transfusion was done during this century, and insulin was injected to the patient, and EEG machine was invented. Then antibiotics were also discovered during the 20th century. Then the pacemaker for a heart disease started during this year. First heart transplant was possible during this century. Artificial heart was installed. Heart and lung transplant was performed during this 20th century. Laser was invented, and this laser was used for eye surgery. Infertility treatments were provided and they were improved. First test tube baby was born during this 20th century. And CT and MRI was introduced. I think you understood what we have introduced in the 20th century. Blood types and blood transfusion, and insulin came into existence, and antibiotics were discovered. Pacemaker, heart transplantation, artificial heart and lung transplantation, laser and eye surgery, infertilities. Then if we go for a modern era, what happens in modern era, that is 21st century? All the advancement takes place in the medical surgical nursing. How this advancement takes place? Due to integration of technologies. These electronic health records, now the records which were noted down, now the electronic health records are formed. All this is recorded, are kept in an electronic devices. Then robotic surgeries came into existence. These robotic surgeries are computerized surgeries or computer based surgeries. And telehealth, increase in autonomy, that is autonomy is overall patient care was provided by the nurse, that is clinical decision making was given by the nurse, and advanced role of nurse took place. These are the things which has happened in the evolutions of the medical surgical nursing. When we talk about the trends of medical surgical nursing, what happens? Trends, we will tell, no, this is a trend going on. These are the trends which is going in medical surgical nursing. Ongoing trends: evidence-based practices, technological integration, patient-centered care. Okay, these are two. So healthcare reformer, advanced education and certification, ethical concern and cultural competence, consumer orientation, and interdisciplinary collaboration. So evidence-based practice. In trans, we will see first, that is evidence-based practice. What is evidence-based practice? It is like concept. Evidence-based practices are the concept which are used to improve the care of patient to achieve the client's overall health. Then what is patient-centered care? Patient-centered care, like we are focusing on the patient holistic care, not just the illness of the patient. We are focusing on the holistic care of an individual. That is patient-centered care. And we need to respect the patient's values or the choice of the patient. Like we have to provide what the patient needs, and we need to stop what does the patient doesn't need, because we need to respect the choice of the patient. Then when we talk about the healthcare reformer, earlier the healthcare, to take the healthcare facilities, it is very expensive for an individual. Many of them cannot afford to take the healthcare facilities, but due to some reform changes of the healthcare facilities, there are the government programs that takes place for the poor peoples. There is a free of cost health is given. Healthcare facilities are provided to the poor people based on government programs. Then if we go for advanced education and certification, there is advancement in nursing. Earlier nursing was not like an existing nursing like how today current nursing is going on. Earlier there were no much advancement in nursing. Nursing was just a practice which was given to the normal kind of people just. But now today the nursing have a different level, like BSC, MSC, and many other programs, certified based program which is conducted in the universities. It is like professional programs. Then ethical concern and cultural values. We need to understand the patient ethical concern and cultural norms, cultural values. Like what we need to respect the diverse and the values and the beliefs of an individual client's norms. Then consumer orientation. In consumer orientation, main goal of the nurse is to like promote the promotion of health, and how to prevent the illness, and how to restore the health of an individual. When he or she have acquired any kind of disease, we need to restore their health. And disciplinary collaboration is we are collaborating with the other healthcare members, we are collaborating with the dietitians, physicians, we are collaborating with the therapists, physiotherapists, because we are collaborating with the other healthcare members to restore the health of an individual, to make them function as earlier, like how they earlier used to be. If their illness is occurred, we need to cure their illness, we need to restore the health of an individual. This is how are the trends in the medical surgical nursing. I hope everyone understood. Thank you.